Hello everyone. So today's topic is scapula. It is large and it is triangular and it is flat bone lying in the posterolateral aspect of the chest wall, opposite to the second and the seventh rib. It forms part of the shoulder girdle. So it possesses two surfaces, costal and dorsal surface. There are three borders: lateral, medial and upper border. There are three angles: superior angle, inferior angle and lateral angle. Superior angle, inferior angle and lateral angle. There are three processes: spine, coracoid process and acromion process. Now determination of site. So there are two scapula in our body. So during the exams you have to understand that you have to show the examiner the side right away. So how will you determine the side? So now this process, this side is called the glenoid cavity. It is pear shaped and it faces laterally and it is forwards. Now dorsal surface bears a spine, so it will be dorsally. So here in this bone it is the left sided bone, so you have to hold it with your left hand. Now the coracoid process, which should point forwards and slightly laterally. Now coming to the surfaces, first of all the costal surface faces forwards and medially. It is concave and hollowed. Now attachments are subscapularis, whole area subscapularis and serratus anterior. Now serratus anterior is along the medial border. Now first and the second digitations of the muscle extend from the superior angle to the point opposite to the spine. Third and fourth digitations extend from the spine to the upper part of the inferior angle, and fifth to eighth digitations are inserted into the oval area at the inferior angle. Now dorsal surface divided into two halves by the spine. Upper is known as the supraspinous fossa and lower part is known as the infraspinous fossa. Two fossa are communicated by each other through a spinoglenoid notch. In this notch, the suprascapular nerve passes. Attachments in the dorsal surface: supraspinatus from the medial two-thirds of the supraspinous fossa, infraspinous from the infraspinous fossa, teres minor from the upper two-thirds of the flattened part of the adjoining the lateral border, teres major from the lower oval part adjoining the lateral border below the teres minor, and latissimus dorsi, some fibers from the dorsal surface of the inferior angle. Now coming to the borders. Lateral border is also known as the axillary border. It is the thickest of all borders and it extends from the lower part of the glenoid cavity to the inferior angle. Infraglenoid tubercle is present, which is round and is a raised triangular area below the glenoid cavity. Now, attachment here are origin of the teres minor, upper two-thirds of this border on the dorsal surface, teres major from the lower one-third of the dorsal surface. Now medial border is longest of all border. It extends from the superior angle to the inferior angle. Attachments are insertion of the levator scapulae between the superior angle and the spine, rhomboideus major between the spine and inferior angle. Okay? Now upper border is the thinnest and the shortest of all the borders. It starts from the superior angle to the extends from to the laterally to the suprascapular notch, is converted into a foramen by superior transverse scapular ligament. Now the suprascapular foramen transmits suprascapular nerve to supraspinous fossa and suprascapular vessels. Now coming to the attachments, here the attachments will be inferior belly of omohyoid near the suprascapular notch. Now coming to the angles, inferior angle is formed where lateral and medial borders meet. It lies opposite to the seventh rib. Attachments here, as you know, is the latissimus dorsi. Superior angle lies in the junction of the superior and medial borders. Now processes, spine of the scapula is a shelf-like process or projection. It is triangular in shape, and attachments are deltoid, posterior fibers, trapezius, supraspinatus, infraspinatus. Acromion process. Now acromion process arises nearly at the right angle from the lateral end of the spine, project forwards, subcutaneous and overhangs the glenoid cavity. Has two borders. It has two borders, lateral and medial. Lateral border continues with the lower lip of the crest of the spine. Medial border short and it continues the upper lip of the crest of the spine. It has two surfaces, upper that is rough and lower that is very smooth. Now attachments are the deltoid, trapezius, coracoacromion ligament, capsular ligament of the acromio-clavicular joint. Now coming to the coracoid process, it arises from the upper part of the head of the glenoid cavity of the scapula and lie below the clavicle. At first it ascends slightly upwards and medially, then abruptly bends forwards laterally. Thus it is divided into ascending and horizontal part. Okay? Now upper surface present the conoid tubercle. Upper surface present the conoid tubercle, and it is at the point where the coracoid process changes direction. Now the other thing that it presents is the trapezoid ridge, which extends forwards and laterally from the conoid tubercle. Attachments are pectoralis minor inserted on the upper aspect and medial border of the horizontal part of the process. Coracobrachialis and short head of biceps arises as a common tendon from the tip of the coracoid process. Coracoclavicular ligament has conoid part to conoid tubercle on the dorsal aspect of the junction of ascending and horizontal part, then trapezoid part that to the trapezoid ridge on the upper surface of the horizontal part of the process. Coracoacromion ligament to the lateral border of the horizontal part in front of the beak. So thank you. This is all about the scapula. I will be bringing more videos like this. Thank you.